Hello, Abbotswood. Thank you for joining me for this month's Health Talk. My name is Mike. I'm the Rehab Director for Legacy here at Abbotswood. I'm also one of the physical therapists. Today we're going to be talking about COPD, okay? It's a disease that affects a lot of people in this community. A lot of people may not even know what it stands for, so we're going to go over a lot of things to kind of clear up some of the ideas that may be going around. So COPD, the first thing, it stands for chronic obstructive pulmonary disease, okay? And when we talk about the definition of COPD, it's a chronic lung disease that affects many Americans. Most people don't start feeling symptoms of the disease until they're between 50 and 70. Doctors use the term COPD to describe two different diseases. Most folks with COPD usually have one or both of these diseases. The first one is emphysema. That's when the air sacs in the lungs and the small airways lose their elasticity, so it makes it harder for you to breathe. It makes it harder to get air in and out of the lungs. The second one is chronic bronchitis. This is when the airways become swollen and inflamed, and they produce large amounts of mucus. Okay, that also makes it very hard to breathe, and can lead to a lot of infections because that mucus tends to sit in the lungs, and then bacteria can grow, and that's how we get pneumonia and those types of things. So again, the definition of COPD. It's a chronic lung disease, okay, and it includes two separate diseases. And when you're diagnosed with COPD, it means you may have one or both of those things going on at the same time. Those two things, again, are emphysema and chronic bronchitis. Just to give you a little background data and that kind of stuff when it comes to COPD. Data from the National Health Survey indicates that COPD affects 24 million Americans, and that number seems to be growing every year. COPD causes 13.4 million doctor visits per year and over 600,000 hospitalizations each year. So it's a huge number, it's a huge strain on the health system, and so we want to do everything we can to avoid these conditions if we can, and then if we do end up being diagnosed with one of these conditions, do what we can to limit those doctor visits, limit those hospitalizations. COPD is actually ranked the fourth leading cause of mortality for adults ages 65 to 85 years old. So again, it's up there when on the list of causes of death and mortality. So again, it's something we want to avoid if possible. If we are diagnosed with COPD, then we want to make sure we are appropriately taking care of it, so we don't end up a part of these statistics. When it comes to risk factors for COPD, the number one risk factor is a history of smoking, or if you're a current smoker. Some other risk factors include work-related dust and chemical exposure, secondhand smoke exposure, having recurrent lung infections, or having childhood respiratory infections that are linked with decreased lung function can also be a pretty big risk factor. Exposure to indoor air pollutants from fuels used for cooking and heating in poorly ventilated homes. Again, these are all just risk factors. And then heavy exposure to air pollution. So again, a lot of those things there's nothing we can do about. Some things we can. So if you know that one of those risk factors is associated with you, we may talk about things we can do to change those risk factors. Again, if you were a smoker for 30 years and we've quit, there's nothing we can do about that 30 years that we smoked, but there are things we can do moving forward to decrease the complications and problems from COPD. Some of the complications and problems that we want to talk about are a with phlegm, shortness of breath during activities or breathlessness in general, wheezing when we're breathing, so you're actually hearing something coming from the lungs, chronic respiratory infections. Again, these are all just complications and problems if you have been diagnosed with COPD. Overtime breathlessness, and that's basically worsening of breathlessness as you are completing your normal daily activities. So as you go throughout the day, the breathlessness seems to get worse and worse and worse over time. That again is a complication or even kind of a sign of COPD. General tiredness and fatigue, poor concentration due to lack of oxygen, and then heart strain. Lots of times COPD and heart disease go hand in hand, since smoking is the main risk factor for both diseases. So again, if we're having difficulty with COPD, the heart may be working a little harder, and that is going to cause edema or swelling, usually in the ankles and feet. So again, that is a good sign that something may be going on with the heart or the lungs or both. So now that we kind of know what it is, we kind of know the complications and the problems that it can cause, we want to go over some of the preventive strategies and interventions that we can do now to make sure, again, that it's not affecting us as severely as it could. Early diagnosis and treatment of COPD is better for long-term quality of life for individuals who have the disease. A physician should do a medical workup, including testing to diagnose COPD. COPD cannot be cured. However, there are many things we can do to make the symptoms much more manageable. So the very first thing that everybody will say is if you're diagnosed with COPD, you have to quit smoking if you're still a smoker. Again, it's the highest risk factor. It's one of the things that causes the most problems. If you're diagnosed and you continue to smoke, you're going to have a lot of those complications and a lot of those problems along the way. So quitting smoking is number one. Obviously, there's a lot of different avenues you can take. When it comes to quitting smoking, I would talk to your health professionals if you're having difficulty with something like this, because like we say, there are a lot of different options out there, and we just need to find the one that best suits you to make sure that we can quit and we can remain smoke-free for the rest of our lives. Some other things that help with prevention is making sure you understand your COPD medications. So once you're diagnosed, your doctor may prescribe some medications. So understanding what they are, what they do, how we're supposed to take them, how often. Again, just having a good idea of what those medications are for, and again, how to use them properly, will make sure to keep the complications and problems of COPD kind of at bay. Talk to your doctors about the flu and pneumonia vaccine. Obviously, getting those, having COPD, you increase your risk of getting pneumonia because of that mucus that kind of sits in the lungs. So getting those vaccines may be very helpful to make sure we don't have any other complications from those illnesses. Getting plenty of exercise and eating well and getting good nutrition. Again, I think that's a big part of a lot of these diseases, a lot of these issues can all be helped by exercise and making sure we're getting proper nutrition, that type of thing. Conserving your energy and controlling stress, again, good idea just in life in general, but even more so when you have a disease like COPD. There are different techniques that you can come up with to help conserve energy and to control stress. Again, we have to find the ones that work best for you. So again, talk to your health professionals, come by the Legacy room and ask questions. I've been doing a chair yoga class, which incorporates some meditation. That's every Thursday morning at 9. So tune into that, again, if you feel like that would be appropriate for kind of stress management and stress control. In that class, we talk about breathing quite a bit. Another good way of prevention and intervention strategies is controlling your breathing and having some breathing techniques that you can do to kind of keep that air in the lungs a little longer to make sure that oxygen gets to the muscles in the body where it is needed. And then the last one is using oxygen therapy if your doctor prescribes it. And again, understanding the use of that oxygen, when you're supposed to be using it, what level you're supposed to be using it. So just having a good understanding about, again, how it's supposed to be used is going to make a big difference in your life if you are diagnosed with COPD. So again, great news in your community that we have qualified therapists who can get you started on pulmonary rehab and exercise programs to get your body stronger. We can create a customized program to help you achieve your goals and enjoy your life to the fullest potential. A lot of people, and I hear this quite a bit in the community, they just say, I'm so tired, I can't start an exercise program because I don't have any energy in the first place. You know, doing an exercise program is just going to make that worse. I understand that. Again, part of COPD is that general fatigue, that general tiredness. Your body's working very hard just to breathe and to get through your normal daily activities. Breathing, again, burns a lot of energy. So again, you feel that fatigue during the day. But I'll tell you, with tons and tons of patients that I've seen here, once we get into that program, we go by what you can do at that time. We'll continue to push you as we see fit, and as is necessary to kind of start to make progress. But what I found is that a lot of people very quickly say that tiredness goes away. They're able to do more during the day. So again, don't let that hold you back, just because you're feeling so fatigued right now. Again, getting into a routine, doing some exercises may actually help that feeling, and then again, make you not so tired when you're doing your normal daily activities and just trying to make it through the day. So we've gone over a lot of information today. Again, the definition of COPD is just chronic lung disease, okay? And it includes those two diseases, emphysema and chronic bronchitis. Emphysema is when the air sacs in the lungs and the small airways lose their elasticity, so it's hard to get air in and out. And then chronic bronchitis includes the swollen and inflamed airways, and you produce a large amount of mucus. That also makes it harder to breathe and leads to infection. We talked about pneumonia. We kind of talked about the evidence. Obviously, it's very prevalent in our country. It's very prevalent in the age group for Abbotswood, and is one of the highest leading causes of death in the United States. So again, very, very serious issues. We've talked about some of the risk factors that go along with it. Number one being that long-term history of long-term cigarette smoking, childhood respiratory infections, and then we've gone over some of the prevention strategies and interventions. Again, there's things that your doctor can prescribe and your doctor can do for you, and there's a lot of things that a therapist and an exercise program can do for you. So please reach out to any of the Legacy staff if you have questions about this. If you'd like to try to get a program started, please again reach out. We're on A-Wing. Our phone number is 919-848-2233 if you have any questions, or just flag me down in the hallway at any time. the wellness department is doing an amazing job right now, since we are kind of restricted a little bit into our rooms a little bit more. They've gotten a lot of the exercise programs on the Touchdown channel, so please, please, please take advantage of that, if nothing else. We are restarting some of the exercise classes live, so continue to look at your schedule for those. And again, if you guys have any questions, please reach out to me. I hope you guys enjoyed this health talk. I will try to do this every month. If you guys have any ideas on something you would like to have a little bit more information about, let me know. I'd be happy to try to put something together for you. Otherwise, have a wonderful day. Thank you for coming.